Hello, my name is Dr. Gaurav Rajashekar. I go by Dr. Raj. I'm a transplant nephrologist at U of L Health. Why I became a healthcare provider was when I was a young kid. I had this community physician come to my house to give insulin to my grandfather, and he always had the biggest smile on his face every time, and I felt like this was like a calling, something that I would want to do in the future, to be someone like him and to help people. I'm a transplant nephrologist. First and foremost, you should know that we're not surgeons, but we are nephrologists who take care of patients from the time they get the kidney. We make sure that there's no signs of rejection, there's no signs of infection. We manage their medications. We basically become like primary care physicians, and also at the same time take care of their nephrology or kidney needs for these patients. If you don't treat them like they're your friends and family, or give the same amount of time you would give your friends and family, that means you're doing injustice. So no matter their complaints, no matter what they have, no patient is simple, and they're coming to you, so you spend as much time as you can with these patients. And that's the way I treat my patients, is like my friends and family. We have patients coming in with different forms of kidney problems in different timelines, and we have providers to take care of all of it. So I'm a transplant nephrologist. I take care of this side of the spectrum, but whereas we have other colleagues who take care of the chronic kidney disease problems. But in the end, we're a big team. And that's the best part, because communication is easier. Each of us know the other patients pretty well, so there's a lot of communication. It's a big team, which you generally don't find in a community practice, where it's more isolated. There's either a single provider taking care. It's hard to find other colleagues in the same area. So I feel University of Louisville has built a structure in such a way that everyone's in the same umbrella, and the patient never gets missed out, no matter what their complaints are. Fun fact about me is I have bilateral shoulder dislocation. So it's like I love lifting weights, and that's my hobby, or more than anything, I do that every morning. I just feel it's like a stress buster, and more than anything, it just gets you out of the system and you're in your zone. At the same time, I love beer and bourbon. So I think I'm in the right place in Kentucky for that, for beer. There's so many breweries out here, and there's so many distilleries and bourbon trails that I'm yet to try out. So that's a fun fact about me.